My name is Kelli Stahl. I work at Cook Children's Henderson Clinic. I've been there 9 years. I work mainly for, there's 5 pediatricians in our clinic, and I just rotate between them as needed. And we take care of sick kiddos, same-day sick appointments. We really pride ourselves on that we can get kids in the same day to be seen. And we also do checkups. And of course, there's lots of other things that we take care of as a primary care clinic, but it's a fun place. There's never a dull moment, and it's fun to take care of the entire family at Cook's. So I came to Cook Children's as soon as I graduated RN school, which was in 2014. It was December 2014 when I graduated. And then February of 2015, I got hired on at the clinic. And at that time, it was for Pediatrics. But when I was interviewed and came on board, my manager at that time explained to us that the owners of the practices of Fort Worth Pediatrics were in the process of selling their share to Cook Children's. And so I was very excited about that because it was my dream to work at Cook's. And I was looking forward to Fort Worth Pediatrics building that experience and that resume for me so that I could go on to Cook Children's. But I didn't have to. I am a third generation nurse, but the reason I chose to be a nurse was because of the excellent care I received through Cook Children's during my childhood cancer diagnosis. I received amazing care, just something that's just indescribable care from Dr. Bowman, my pediatric oncologist, all the way down to the tech who drew my blood. And I just loved the environment. It was a second home to me. There were lots of milestones that I hit, lots of character building. And so when I became a nurse, I made a promise to myself that I was going to give back the care that I was given for those 3.5 years. And so anytime I walk through those clinic doors, I have that bar that's set pretty high to give back to those kids that I was given. So growing up during my cancer diagnosis, I was able to given opportunities to share my story several times, whether it was in person or through essays or any other things within the community, to just reach out, share my story of hope and encouragement. So I kind of already had my story kind of written and set, in my heart, in my mind, and on paper. And so I wanted, and as I became a mom, I wanted to leave something for my children to have so that they could understand a little bit of what I went through when I was a young girl. And so I wrote this book for them. My mom and I put it together. My mom was able to put in dialogue and conversations that were had between the doctors that I was not a part of, which is a good thing, and just be able to fill in the gaps of the things that I do remember and the pain and the experiences that I had to go through and had to grow up pretty quickly. And so I just want my kids to kind of understand me and know me a little bit better.